Are you tired of spending overnight reading books and having difficulty remembering all those contents just to pass your upcoming examination? Nursing Studio makes it easy for you. We provide detailed explanation on nursing lectures in a more fun and exciting way. Through animated presentations, this will help you save time and easily remember important things, so that you can make sure you will have that name extension after your last name and have that license ID soon to be in your hands. Just get a paper and pencil and watch the video. You will be presented with several sets of questions and write it down if you got it correctly or not. A notification will be indicated if you are already on the last question. Pass rate is 100%. Let's aim for the stars, so that in case we wouldn't make it, we will still land in the moon. So hit that subscribe button and turn on notification bell so that you wouldn't miss any of my video. Let's get started.
Question number 1.
Marky is suspected of having appendicitis. In which area of his abdomen do you expect him to feel the pain? A. Right lower quadrant. B. Left lower quadrant. C. Right upper quadrant. D. Left upper quadrant. The correct answer is A. Right lower quadrant. Our abdomen is divided into 4 quadrants, wherein the navel serves as the center point. The appendix is located in the right lower quadrant, therefore an inflammation can cause pain in the said area. Pain felt in the left lower quadrant is associated with diverticulitis, an infection or inflammation of pouches that can form in your intestines. These pouches are called diverticula. There's no single known cause of diverticular disease. Instead, experts believe that multiple genetic and environmental factors likely contribute to its development. Pain felt at the upper left quadrant is mostly associated with splenomegaly. The spleen controls the level of blood cells, leukocytes, erythrocytes and platelets. It filters the blood and removes any old or damaged red blood cells to recycle its components. Splenomegaly happens due to multiple conditions. Some of these are tumor in the spleen, bacterial infection, leukemia and malaria. Pain felt in the upper right quadrant is mainly associated with liver problems such as liver cirrhosis. It can also be triggered with cholelithiasis or formation of gallstones in the bladder.
Question number 2.
The point that lies 1/3 of the distance laterally on a line drawn from the umbilicus to the right anterior superior iliac spine, which tenderness is maximal in cases of acute appendicitis, is known as. There will be no option for this item. The correct answer is McBurney's point. It is named after the 19th century New York surgeon Charles McBurney, 1845 to 1913, who was the leading authority in his day on the diagnosis and treatment of appendicitis.
Question number 3.
Upon arrival of Marky to the hospital, what should be the best position in order to alleviate pain in his appendix? A. Lateral position. B. High-Fowler's position. C. Prone position. D. Semi-fowlers position. The correct answer is letter D. Semi-fowlers position. This is done when a patient is positioned on their back with the head and trunk raised to between 30 to 45 degrees. This position relaxes the abdominal muscles and reduces pain. Rationale for incorrect answers. Lateral position stretches down abdominal muscles that may cause discomfort to the inflamed area, thus not advisable for patients with appendicitis. High-Fowler's position is placing the head of the bed 90 degrees in relation to the lower half of the body. This may cause too much downward pull of the abdominal muscles that can cause compression of the appendix. This is only recommended for patient who needs to improve breathing patterns and other radiologic examinations. SIMS is a standard position in which the patient lies on their left side, with right hip and knees bent. The lower arm is behind the back, the thighs flexed. This position is best when administering enemas but is not recommended with patients with appendicitis as it causes compression of the inflamed area.
Question number 4.
Marky asked Nurse Mimi how did he acquire appendicitis. Nurse Mimi is correct if she mentions that the cause of appendicitis is A. Inflamed lymph nodes in the intestinal area. B. Intestinal worms. C. Fecalith or hardened stool. D. All of the above. The correct answer is letter D, all of the above. Lymph nodes surrounding the abdomen cover some portion near the appendix. Once this lymph node's inflamed due to viral or bacterial infection, this compresses the appendix causing it to inflame. Intestinal worms have been reported to cause appendicitis by obstructing the appendiceal lumen. This leads to bacteria trapped inside creating an inflammatory reaction. Same goes with fecalith or hardened stool. The obstruction of the appendiceal lumen causes the bacteria to be trapped inside, thus leads to inflammatory response.
Question number 5.
Nurse Mimi assessed patient Marky and have resulted to a positive Rovsing sign. Which of the following is the correct definition of the assessment? A. Pressure is applied and released on the left lower quadrant causes pain in right lower quadrant. B. Pressure is applied and released on the right lower quadrant causes pain in right lower quadrant. C. Patient lie on his left side while the right thigh is flexed backward causes pain in right lower quadrant. D. Patient raises his right leg against the resistance of your hand causes pain in the right lower quadrant. The correct answer is letter A. Pressure is applied and released on the left lower quadrant causes pain in right lower quadrant. Rovsing sign is performed by putting pressure in the lower left quadrant and then immediately releases it. Causes a rebound tenderness in the McBurney's point. Rationale for incorrect answers. Pressure applied in the lower right quadrant would no longer isolate the diagnosis as the area is already the origin of the pain. Thus, putting a pressure will normally initiate pain. Patient lie on his left side while the right thigh is flexed backward causes pain in right lower quadrant is also a test to confirm appendicitis, however, this is known as positive psoas sign. Patient raises his right leg against the resistance of your hand causes pain in the right lower quadrant is also other way to test for a positive psoas sign and not Rovsing sign.
Question number 6.
Marky was scheduled for appendectomy by 1 p.m. During pre-operative care, Nurse Mimi does not require further teaching if A. Applies warm compress to alleviate pain. B. Should give Marky morning meals to prevent him from getting hungry as the operation takes time. C. Administer antibiotics as prescribed. D. The patient verbalizes feeling fullness even without eating. The correct answer is letter C. Administer antibiotics as prescribed. This will prevent possible occurrence of infection pre- and post-operatively as the surgery is an invasive that makes the patient susceptible for infection. Rationale for incorrect answers. Applying warm compress to the inflamed area causes vasodilation that might lead to rupture of the appendix. Pre-operative appendectomy should be placed under NPO, so morning meals should not be given to the patient. If patient verbalizes feeling of fullness even without eating, is a critical indication of peritonitis. This happens when the appendix already ruptured and abscess spreads out to the peritoneum which will make him feel bloated. Signs and symptoms of peritonitis. High-grade fever, feeling of fullness or bloating, abdominal pain that increases with slight movement, tachycardia in response to pain, chills, weakness and confusion.
Question number 7.
It is a surgical procedure involving incision through the abdominal wall to gain access into the abdominal cavity in order to clear out abscess caused by perforated appendix. A. Laparoscopic appendectomy. B. Laparotomy. C. Endoscopy. D. Cholecystectomy. The correct answer is letter B. Laparotomy. It is a surgical procedure that involves a surgeon making one large incision in the abdomen to remove abscess caused by perforated appendix. Laparoscopic appendectomy is a less invasive method of removing the appendix. An instrument called a laparoscope will be inserted through the incision with a high-intensity light and a high-resolution camera at the front. The camera will display the images on a screen, allowing the surgeon to see inside your abdomen and guide the instruments. When the appendix is found, it will be tied off with stitches and removed. The small incisions are then cleaned, closed, and dressed. Endoscopy is a procedure used to visually examine your digestive system with a tiny camera on the end of a long, flexible tube. This can be done to collect tissue samples, biopsy, to test for diseases and conditions, such as bleeding, inflammation, diarrhea or cancers of the digestive system, and is not merely involved in removal of appendix. Cholecystectomy is a surgical procedure to remove your gallbladder. It is performed by incision of the upper right quadrant of the abdomen and removed the gallbladder. But in modern medicine, this can now be done with 4 small incisions called laparoscopic cholecystectomy.
Question number 8.
A teenage girl is being assessed for possibility of appendicitis. The following conditions should be considered, as it may present almost the same symptoms except A. Ovulation. B. Ruptured ectopic pregnancy. C. Urinary tract infection. D. Pelvic inflammatory disease. The correct answer is letter C. Urinary tract infection. Urinary tract infection can be categorized into 2. Upper urinary tract infection, and lower urinary tract infection. The upper UTI is a condition wherein the bacteria has already invaded the kidneys and ureters. Pain and tenderness is felt at the upper back and sides, not in the lower right quadrant. Lower tract UTIs affects the bladder and urethra, causes you burning pain upon urination, also known as dysuria. Ovulation can trigger one-sided lower right quadrant pain, as the egg and the fluid as well as some blood are released from the ovary. This is known as Mittelschmerz. It is believed that the fluid or blood may irritate the lining of the abdominal cavity, causing lower right quadrant pain. Same story goes with ruptured ectopic pregnancy. If the fertilized egg grows at the right side of the fallopian tube, the rupture can cause severe right lower quadrant pain. Pelvic inflammatory disease, or PID, is an infection of the organs of a woman's reproductive system. The inflammation can cause right lower quadrant pain depending on the area of infection. This includes the uterus, ovaries, fallopian tubes and cervix. It's usually caused by a sexually transmitted infection, STIs, like chlamydia or gonorrhea.
Question number 9.
Your patient is 4 days post-operative from appendectomy. Which assessment findings requires further evaluation? A. The patient reports his last day of bowel movement was the day before surgery. B. The patient reports incisional pain. C. The patient coughs and deep breathes while splinting the abdominal incision. D. The wounds are becoming dry. The correct answer is letter A. The patient reports his last day of bowel movement was the day before surgery. This would indicate that the peristalsis has not yet occurred. Normally, bowel motility should be good after 3 days post-operation. Absence of peristalsis is a critical condition that the medical team should check for a possible underlying conditions. Patient reporting incisional pain can be considered up to 7th day but should be in a reducing pattern. If the patient splints the abdominal incision when he coughs or deep breaths, that would indicate he understood nurse-patient teaching. This is to avoid the incision to be teared out by the pressure. The wounds are becoming dry is a very good indication that it doesn't have any infection and is about to heal. How much score did you get? We have a total of 9 points, as agreed. Our pass rate is 100%. If you didn't make it, you can start from the beginning and be sure you wouldn't make any mistake in every item that you answered. You can support the creator so he can create more videos like this by giving donations. Methods to send donations are listed in the description of this video. If you can't, it's okay, you can provide support by subscribing and sharing this video. Thanks for watching.